Welcome, everyone. If you're looking for the webinar on school psychologists and community health services, you're at the right place. We're going to give it a few minutes to let folks sign on. We are recording this, and we will post it on YouTube at a later date. And I'll try to remind everybody of that as we go along. So let's hold on just a few minutes. Sorry, y'all. I barely touched my mouse and it jumped ahead. Have to be more careful.
That's okay. I think we're still waiting for people
Yeah.
to hop in.
Yeah, we have quite a few signed up, so I'm hoping that they're going to show up. Some, the evening catches up on all of us pretty quickly, and all of a sudden, it's 7 o'clock and you haven't realized it. So hopefully Elizabeth will keep her eye on the waiting room and open it at some point so people can join as they remember. So, but it's just 7:01, so we'll give it a few minutes before we start. One thing we forgot is that the ACC tournament is on. Mm-hmm. When we scheduled and changed the date on our webinar. So we may have some folks fighting for internet space. Mm-hmm. So I'm going to go ahead and get started. I know it's just a few minutes after 7, but I do think other folks will be joining us, and that'll be great. And of course, we're recording this, and so if folks are late or something is intervened in their lives, we will be able to talk to them later. So tonight we have 2 wonderful speakers who join me tonight. And Lee, say hello, wave. Lee is a nationally certified school psychologist. She's a mother. She's an advocate for school psychology. She works here in Wake County. Dr. Cheryl Stallings is our school psychologist. She is a mental health provider. She used to work in the school system, and she now is in private practice in Wake County. Also a mother and a Wake County commissioner. And so I invited Cheryl to join me and Lee tonight. Lee and I have done several webinars together because Cheryl is in a really unique position as a professional in the field of school psychologists, and someone who's having to face these issues, not from the school perspective like Lee does, but from a county perspective as a county commissioner who funds human services in her county. So that's going to be very interesting. I think we're going to learn a lot. So I'm going to help us use our time wisely tonight. We're going to go ahead and get started. And Lee, if you don't mind, I'm going to turn the program over to you for a few minutes.
Okay. Thank you, Yvonne. I'm glad to be here tonight with Dr. Stallings discussing a really important topic. Tonight, we hope to leave attendees with 3 very specific outcomes. We hope to develop a common understanding of what's available to children and families across North Carolina. We're going to talk about data that illustrates the compelling why for this topic, as well as information to show resources that children and family have access to for supporting behavioral health needs, whether the needs are situational or ongoing or lifelong needs. And then lastly, we're going to discuss the known solutions as well as possible solutions and further, future directions that gain children increased access to resources for mental health needs. And we hope to leave the participants with knowledge of what's available right now to support behavioral health for children, even if that's a small step or a step that includes advocacy. I want to just add, before we move to the next slide, that an important and essential message to begin and end with is that mental health supports improved student outcomes. And, you know, there's a lot of data across time that supports that. Okay. What is mental health? The CDC defines mental health. It includes emotional, psychological, and social well-being. It affects how we think, feel, and act. And it also helps determine how we handle stress, relate to others, and make healthy choices. All super duper important things. So first, we start by acknowledging that in North Carolina and really in all states, the behavioral health needs for children lives in several circles, public and private. Funding streams differ. Oops, 1 second. Access varies, and it's a complicated system to understand and one that's somewhat difficult to navigate and explain, even for those who are knowledgeable. I can confidently tell you that I have learned information through developing this webinar with Dr. Stallings, and how we talk about our mental health resources and data that's used to discuss it really impacts children's access. Hang on 1 second, I just lost my spot here. Just give me 1 minute. I'm so sorry. Uh-oh. Give me a second here. I've just lost my spot. Okay, hang on. Okay. So it's worth acknowledging that many families incur a significant financial cost when there aren't sustainable pathways for accessing behavioral health through the public school, through the schools or through public agencies or their medical plan. And we hope that this webinar provides information that helps a child or helps a family who might be dealing with mental health needs. I would predict that everyone on this webinar is in agreement with the compelling why. Advocating on behalf of all North Carolina children's mental health access is, I would just say, never ending. The way we discuss behavioral health and mental health has evolved, especially in the past, in my opinion, in the past 5 to 10 years, both with events, or both because of events that have occurred in schools and in our world. The data from our state really does illustrate the need for advocacy, and my belief is that it is incumbent upon those of us presenting today and you who are attending and other partners in the community to educate, protect, and advocate for the mental health and well-being of children. It is an ethical obligation for those who can advocate. The faces of children that you care for or teach, or children that you know who are representative of those in our society who rely on those like us, like you perhaps, who understand the factors that they carry on that the kids carry on their shoulders and how it might impact their safety and well-being. So the compelling why really has to include both the data that we know about children's behavioral health, as well as the human aspect, such as aspects that are essential to life. I mean, more and more, I do talk to parents about, you know, what types of experiences are bringing peace to your family, what experiences are bringing joy to your life, but also how are we keeping kids safe? How are we building friendships and connections and happiness? So I feel strongly that our advocacy must include social justice practices that decrease the discrimination and create easily accessible pathways for children who have historically been discriminated against, or those who have long faced barriers for medical care, physical health care, and behavioral health care. Okay, next slide. So tonight we're gonna, we have many slides of data. So if you'll just bear with us, we want to spend time talking about the data, because that's a huge piece of it, to understanding how deep this problem is and how much of a crisis it is. So we're going to focus on specific North Carolina information and data. And so as you can see, and to no surprise, there are many factors contributing to mental health concerns. According to data from the 2021 North Carolina Child Health report card, which can be found on the NC Child website, which is a really great organization, and their website has incredible resources on it. 44% of North Carolina children live in poor or low income households, and 3 in 10 high school students from this 2021 study reported using vaping products. That did not surprise me, unfortunately. About 16% of high school students are using prescription drugs without a doctor's prescription. And approximately 43% of adolescents aged 12 to 17 with major depressive episodes received treatment for depression. So more than half of them did not. There's decreased access to affordable health care. Children may have less continuity in care. We know from a whole lot of data that COVID disrupted well-child visits, and kids are, I think we're still seeing, I think in my opinion, we're still seeing kids who are not getting to the doctor once a year. And I know that just from seeing social developmental histories and talking with parents. And parents have varying skills in navigating the healthcare system. I routinely have parents contact me for references to try to get recommendations for mental health professionals. We have families are dealing with decreased access to affordable housing. Children move around more between schools, and some are attending as many as 3 to 5 different elementary schools, with one of the reasons being that affordable housing is just really difficult to find right now and to hold on to in Wake County. So you might have a family that moves to one apartment or house because it's affordable, and then the rent is increased. There's inadequate public school funding. Funding for public schools has not been adequate to address the growing behavioral health demands in schools, nor has it been adequate based on the growth North Carolina has experienced. And low wealth districts are impacted more due to funding. The inadequate funding has contributed to workforce shortages in schools, which in turn is stressing the existing resources, and educators have more options outside the school system than in the past, and are actively being recruited by private companies. There is issues with access to affordable childcare and preschools, and I think everyone has heard or knows firsthand that childcare in some areas is similar to the cost of college tuition, and many childcare centers and preschools have not recovered from the pandemic, and many are struggling to keep staff employed due to low wages. Wages for most people have not kept up with the prices for goods and services, creating housing and food insecurity. And then, the last two are society is fragmented by politics and misinformation. Civil discourse in 2022 and 2023 is difficult, and young minds being fed that misinformation have difficulty sorting, fact from fiction. Many subjects and current events that once would have been respectfully debated and discussed in the classroom are avoided. It doesn't leave them space to work things out in a civil manner. The racial inequity and racial justice many of our children and our students are dealing with and living with prejudice and discrimination in our society, and these experiences are detrimental to their physical well-being and their psychological well-being. And the result of generations of racism are gaps in health outcomes, including but not limited to low birth weight, obesity, hypertension, cancer, and higher infant mortality. Okay, I'm going to move to the next slide. Okay, these are, more staggering factors. Guns. There are a whole lot of guns out there, and we are seeing them in schools. There's increased access to guns in the home and community, And based on data from DHHS, 116 North Carolina children died of a firearm-related injury in 2021. And firearms are the leading cause of child injury death, and they're increasing. I read these and, you know, it hits me. And I was also surprised to find out that North Carolina, if this is wrong, I hope somebody corrects me, because this is what I found out, that North Carolina has no law that requires unattended firearms to be stored in a certain way. I thought that it was, I think a few years ago there was, but so I don't, if that's incorrect, I hope somebody will correct me. But that's what I found. There's also excessive cell phones and social media. And this just really opens pathways for kids to sexual assault and abuse. It contributes to feelings of low self-worth, increased virtual and in-school bullying. And many of these moments when our kids are on phones and viewing social media information, they're doing this in isolation. And it occurs with children who might not have a caring adult or someone else, a caring person in their life to help sort through these things, help correct misinformation, help correct negative messages that they're getting, and balance it out with healthy messages and help the things that are positive in life. There's limited healthcare and limited network coverage. So about every statistic that I talk about, I got from a source, and I've cited it, and the PowerPoint is going to be provided to participants. But about 20% of women ages 18 to 44 don't have health insurance, and about 15% of parents are without health care coverage. So you might find a therapist with an opening, but they might not be in your network. So that's a common thing too. School actually may be the only place for children to receive mental health care or ongoing stable health care. There is ongoing support for mental health to be delivered in schools or school-based centers. And I can tell you from firsthand experience that kids will refer themselves. And I routinely tell parents, even for some kids, just, a 30-minute session or just an hour talking with a school psychologist in school, sometimes that is sufficient time to ground them, teach them a coping skill, and then always get them back to learning. It also provides us with information to know if we need to refer out or need to dig deeper, or if there's some other more serious issues going on. But what is hurting that right now is the workforce shortages in the school psychology profession and other helping workforce shortages that might impact children in school and in the community. So right now we know that in North Carolina, there's about 780 school psychologists serving about 1.5 million school children. And if you know a college student interested in this profession, please contact me, because we do try to recruit, get kids interested in it in high school and get them interested in it. If they're interested in psychology, it's a great field to go into, and it's wide open. There is also limited availability of licensed school psychologists in North Carolina, and to provide adequate coverage for testing and for mental health. And there's many rural school districts, about 28 right now, that don't have a full-time employed school psychologist. And they do rely on the private school psychologist, but there aren't enough of us. So those kids have, they probably, 28 of them don't have a school full-time employed school psychologist in their school district. And then they have decreased access if there's not available privately licensed school psychologists. So lastly, I just want to say, that we're human, and we all need connections that we might not be getting enough of. And children need more one-on-one time just for love and support. But that isolation leads to disconnection, and that's a danger zone for children. So even the conflicts that arise in groups of children offer moments for problem solving and help them understand others over time. But not having that group connectedness really is leading to some sad outcomes and frustrated teens and adults. Okay, let's see. I think we can move to the next slide. Let's see. Okay, so this next one is I say the 1,000-foot view, or big view of what is going on. There is a mental health crisis in North Carolina, but it's part of a bigger global crisis. So you see these statistics are fairly staggering. I got this from Project Healthy Minds, and there's about 60% of people with a mental health condition that go untreated, that leads to all sorts of outcomes. North Carolina specifically ranked 31 out of 51 states where there's high rates but a lower access, and that's from a 2022 state of mental health in America. So I just want you to take a moment and think about how our schools are absorbing that mental health concern in the world on a daily basis, and how that plays out, because there's some things that are going on with kids right now that are I think are being normalized and should not be normalized. All right, you can go to the next slide. So specifically, in what, as far as like direct access in schools, some behavioral health data that's very specific to school psychologists. To give you, an overview, we really need more school psychologists to address students' mental health crisis and to support educators in responding to mental health, because I'm not always responding to kids' needs directly. Sometimes a lot of the times I'm consulting with teachers and saying, these are some things that you can do or that you can be aware of when you're working with kids. Our ratios right now are one school psychologist to about 1,900 students. That's going to vary, and that's an average, but that's going to vary greatly, because in the rural districts, it's going to be higher. And then in urban districts that have that are able to recruit more, it's going to be lower. But the recommended ratio is 1 to 500 students. So we're a pretty long way from that. School psychologists, we are uniquely trained to support student mental health needs in schools and to support specifically students with disabilities. And I can confidently tell you that, again, just brief periods of time, sometimes, not always, but many times, just me having a brief period of time with student to teach them a coping skill, it's enough time. And there are many who need far more than that. But we are trained in triaging mental health needs and responding to it. I think I said this already, that there's about 780 of us, and there's currently about 80 vacancies across the state. That greatly impacts rural districts. But I can tell you that we are seeing it also in all of the urban school districts. We're seeing it in every school district. So, okay, can we move to the next slide? All right, so when children, this has information, the group of individuals in schools that are the helping professionals are called specialized instructional support personnel. So when children make unhealthy choices at school, any or all of these people are involved, but we need to increase access to mental health by increasing the number of helping professionals, such as school psychologists, for children to have that access. It makes such a difference. And it also, when we have a fully staffed team, it means that we can immediately address a variety of mental health concerns. And it means we can collaborate with others to figure out where are there some other problems going on with that student. And this is especially true for children with disabilities. So we really must raise salaries to levels that are comparable to other states and practitioners in other settings. And we need to provide funding for staff development in trauma-informed practices for schools so that educators can feel confident in recognizing and providing some level of triage, and then linking that child with a helping professional. Okay. This next one, this is information from, this is out of NC Healthy Schools. This is the Youth Risk Behavior Survey, and this is from 2021. And these are pretty powerful statistics that, you know, almost 20% of high school respondents have seriously considered attempting suicide. So if you look at the percentage and then just, you know, the raw number, that's a lot of kids in our high schools, you know, thinking about and making a plan for suicide, which is horrible. That's our worst nightmare, right? We don't, you know, this is something that we have to advocate for. We have to provide resources for it. That's just a whole lot of children thinking about suicide, planning it, and trying it. And our population that is LGBTQ, 48% of that population in high school seriously considered attempting suicide. So it's almost double. It's more than double, actually. And 36% of them made a plan for suicide, and 21% of them attempted it. 30% of high school students who responded, also, again, with access to guns, reported that it would take them less than an hour to get and be ready to fire a loaded gun without a parent or another adult's permission. And that tells us that there's a lot of guns in homes that aren't being stored safely, and the kids know about it. Okay. Okay, next slide. This is some additional data. This is from NC Healthy Schools, and this was also recently published Youth Risk Behavior Survey data in 2021 to illustrate what are kids turning to. So if we wonder, and we don't have to wonder, what are kids turning to for relief? If they're not getting mental health, and we know that a whole lot of them are not getting relief and learning coping skills when they have mental health needs, this is what they're turning to for relief. And this is what they're filling the gaps with. Alcohol, marijuana, they're turning to guns, and 49% of them do feel good about themselves, but that leaves, you know, 51% that don't feel good about themselves. And quite a few feel alone in their life, you know, again, with the disconnectedness and the isolation, but and 22% of them did something to purposely hurt themselves. I'm, you know, the last one is, you know, the 60% of high school students reported having at least one teacher or adult in school that they can talk to. Would be great to see that quickly jump up to 80%. It'd be wonderful to see 100%. It's disheartening to see that we don't see, you know, you should have at least one, if not a handful of staff in high school that you feel like is someone that you could turn to and talk to. But I really feel like, you know, for all the parents with us tonight and for all who work with children, you know, just think about the faces of those that you see and that you teach and you care for daily. Everyone has the capacity to make a difference, you know, in one or perhaps many lives. And I think, you know, we have a lot of capacity here to move this. Okay, I'm going to do the next slide. Okay, Cheryl, I think I am pivoting to you for this next one. Cheryl?
I'm wondering if we've lost Cheryl.
Uh-oh.
I don't know if she's lost connectivity, but I don't see her. I'm trying to see if I can get her back here.
Do you want to move forward with some different slides? And
Well, I'm trying, sorry, everybody, this is not difficult, but you know, something's going on here and I'm not quite sure. So, you know, we've been on for quite a while, so I'm going to, Lee, I tell you what, I think we should just move ahead and
then come back to these?
a little bit about, you know, let's just go ahead and talk about these slides, because I'm hoping that Cheryl will be able to join us sometime soon. I think that one of the things that we'll know is that behavioral health information within North Carolina, we're just trying to give you guys a good overview. And one of the things that we know is that this is such an important issue that even the North Carolina State Board of Education has put this in as part of their strategic plan. Okay, and you can see, I won't read this to you, but you can basically see that, you know, they have outlined a tremendous amount of research that shows the benefits of social emotional learning. And all of this research shows to how important all of this is within a school climate and what happens there. You know, especially all of you have probably read a lot about and been involved in or understood from the media or from your own children or your own profession or your grandchildren, issues that are going on around cyberbullying and those kind of things. And we know that when schools have strong programs that, you know, with social emotional learning, that they also have increased academic performance. So that's the one reason why this is part of the strategic plan. And one of the things that I will say about all of this is that school climate is absolutely one of the most important, whoops, I went the wrong way, y'all, hold on. Important issues around any school. When you talk about school safety, you talk about self-esteem, you talk about child's happiness at school, their success at school. It's very related to what the school climate is in that community. Hello, Cheryl, you're back. Okay.
I'm so sorry. Yes, my connection dropped. I apologize. I'm back.
Okay, so we went ahead, so we're ready to start right here. And I think this is I stood in for you for a few minutes, but I think I did okay, but I'll let you jump in right here.
I'm sure you did. Well, behavioral health data, was thinking that was Lee's information. I was coming in on the Wake County data. So
that's perfectly okay. Let's just go ahead here. And this again is some of the data that we have. And Cheryl, you want to maybe go over this slide a little bit quickly?
Well, it comes from the
Lee. I'm sorry, Lee.
Yeah, Lee's going to go over this, I thought.
Oh, I am. I thought you were going to do this one, but one of us can. The humans.
There's a Department of Administration number here. And what is this number for? Is this to report human trafficking, Lee? I'm not quite sure.
I will say I didn't put this slide in here, so I'm not sure.
Okay, so maybe I did it and don't remember. But one of the things that the Board of Education.
Sorry, I think you did it, Yvonne. So take it away.
Okay.
I just did the Wake County one.
Apologize to our audience and those who were listening to this recording. We've gotten off kilter here, losing internet and getting back on and getting back in place. But one of the things that there is a helpline that has been set up, because a lot of things that are going on with social media these days and bullying and cyberbullying have to do with also the awful topic, which is human trafficking. And this number, we just want to make sure we brought it to your case, because North Carolina is number 9 in 50 states of cases being reported for human trafficking. And so the Board of Education was called on by the General Assembly to address these issues and make sure that that there's awareness and prevention in schools, and mandating that, you know, anyone who sees or knows or any of this information in a school setting is required to report it. And so part of that is the training they do in health and safety education of 7th graders. But one of the things that school psychologists often have to deal with within their school setting is dealing with issues around child sexual abuse and sex trafficking. And so all the staff have been trained in these issues and trained how to make sure they protect kids and refer kids and these kind of things. So next slide here is, this is data within North Carolina, that one more look at some data that this is, Lee, I think this is yours, that you are very knowledgeable about the NC Suicide Prevention Action Plan.
This is just put in here as an awareness that there is a statewide plan for addressing suicide. This plan is through the Department of Health and Human Services, and it was created through a collaborative process with experts from across North Carolina, and it does include several stakeholders. Based on the plan, the North Carolina Suicide Prevention Action Plan is focused on, quote, specific actions to be taken in North Carolina over the next 4 years to reduce injury and death by suicide. So that's if you are interested in reading that, you can Google the NC Prevention Action Plan and read what is in there. And then the next slide is has to do with the top 3 needs.
Yes. Now,
okay.
I can take this one, Lee. First of all, I just want to say kudos to Lee. As you all can tell, she did an enormous amount of research for this presentation, and I just appreciate her so much. And so she did most of these slides, and I want to give kudos to her. But I wanted to share a little bit about some data from Wake County, as I am one of your county commissioners, recently elected this November. Prior to that, I served on the Apex Town Council, and I've served as a school psychologist in Wake County, including a number of other public districts in our state. And I currently have a mental health practice in Raleigh. But I wanted to highlight this needs assessment that Wake County did. This type of assessment is done every 3 to 4 years in Wake County. And the purpose of it is to invite information from our various leaders, stakeholders, and residents on community health needs in Wake County to try to understand what are our current strengths, what are our current needs. And this will guide the commission in terms of our policy, our goals and objectives, and also it will influence our budgeting. And so the most recent assessment was done in April of 2022. And the top 3 community health needs that came out of this assessment were affordable housing and homelessness, access to health care, and mental health care needs and services. And then when we dialed down a little bit more and asked about health conditions specifically, mental health was consistently rated as the top health condition that was negatively impacting Wake County the most. All right, next slide, please. And there was also a Wake County Behavioral Summit that was done in March of 2021. And this was conducted or led by our staff. But again, we were tapping into local leaders, local mental health leaders, as well as community members. And again, we were tapping into behavioral health needs and priorities for Wake County. And these were the 4 takeaways that this summit found. And it's really consistent with a lot of the data that's already been shared. Number 1 is that COVID-19 has increased the need for crisis services and behavioral health services. I think we all would agree that the mental health system was fragile before COVID, and we all would probably agree that needs were just clearly magnified and exacerbated by the COVID pandemic. Number 2, we're seeing hospital emergency rooms. They're seeing increased numbers of residents with mental health and behavioral health needs. 3rd, the capacity for crisis services for children and youth is inadequate to meet the demand that we're seeing. And then 4th, as Lee has pointed to already, mental health needs are just compounded by a number of other issues such as housing instability, barriers in transportation, food insecurity, and then just an inefficient access to assessment and treatment, which then can lead to more contributing factors of mental health crises. So these are data that we're getting in Wake County, which is really consistent with what we're seeing statewide as well. Okay, next slide, please. I think one more to go. Yes. Lee, did you want to take this one?
Yeah, I can take this one. So, so there is good news. I know it's a lot of, we felt strongly that you've got to have the information in front of you to know what the problem is, but there is good news. There are resources to support our children. In North Carolina, we have a variety of resources available in schools and available publicly. Hopefully our slides capture many of the resources readily available. So, you know, from the top through, this is through the North Carolina Department of Health and Human Services. We have NC PAL. I will say I do not know a lot about this, but I hope to learn more about it. This is the NC Psychiatry Access Line. The number is listed there. I've copied exactly what is from DHHS. It's accessible Monday through Friday, 8 to 5, provides early access to psychiatric care. If anybody has ever tried to find a psychiatrist, it is not easy. And many people are resorting to just paying out of pocket as much as $450 for a visit. Very difficult, and it leads to less failing up to higher and more expensive care. There is also, the next on this list is mental health first aid. This is a skills-based training. It teaches participants about mental health and substance use challenges. I emailed, there's numbers on there. I've got the link on there. If you email, you will get a pretty quick response back from someone. And it sounds like they provide packets of information to groups. And then I'm not extremely clear on how it works after that, but that is a resource and somebody will respond to you. Triple P is Positive Parenting Program. This was pushed out really heavily during COVID through DHHS. Families can access this. This is a self-paced online parenting program. It's in a variety of languages, and it promotes children and teens' emotional well-being. You can go on there. You click. It takes you to. It asks you the age group or the age of the person that you would like to get parenting skills on, and it's readily available. So it was pushed out during COVID for all of the reasons that I don't think that we need to review, but I routinely talk about this, especially when I'm in groups of, kindergarten and first grade teachers and second grade teachers. There's a lot of frustration among parents right now, but this is a resource for them. All right, next slide, please. So in schools, what do we have available? You have a school psychologist available if you are in most school districts. Children have access to school psychologists, and then what we can support with is their behavioral health needs. We can and we do collaborate with teams. I routinely consult with teachers. I will say every single year, I go, you don't use this great free and easily accessible resource known as just email me and I will come to your class and I will consult with you. I can do a lot of things that I think I have to provide reminders to, but in Wake County schools, every single school has a school psychologist assigned to them. And then we each have 2 schools, but we especially support students with disabilities. So we sometimes forget that, students with disabilities have mental health concerns. They have learning difficulties, but a whole lot of them have mental health concerns as well. Okay, next slide, please. Again, direct access. The team of helping professionals in schools is SISP, specialized instructional support personnel, school psychologist, school counselor, school social worker, school nurse. They're staffed in all K-12 traditional public schools in Wake County. We provide, as a team, we provide annual safety trainings at the beginning of the year, and we team together to conduct screenings for human trafficking prevention. So we provide a beginning of the year training that all staff, by state law, Session Law 2919-244. That was the suicide threat and human trafficking prevention. And then all schools across North Carolina operate within a multi-tiered systems of support, and that includes behavioral support. So sometimes we think of multi-tiered systems of support to be the academic supports, but it is also the behavioral support. So all students receive or have access to social emotional learning lessons. And when students need more, districts have tier 2 and tier 3 behavioral supports. Specific examples of those include some kids will receive lessons on zones of regulation. Some kids receive coping cats. We have access to Second Step, which is a evidence-based social emotional learning curriculum. Okay, next slide. This is, let's see, I think this was already covered. This might be a little bit redundant, but Department of Health and Human Services and the Department of Public Health have partnered to address the suicide prevention. And these are 7 focus areas, but to find out more, the source of the information is at the bottom. But these are coordinated efforts that are being made based on the data that we have to support that. All right. Okay, and then the next slide. Okay, thank you. All right, so specifically in Wake County schools, and this is information. I'm assuming that many of our participants are interested in what's available in Wake County public schools. This slide contains information that was presented at a September 2022 board meeting showing the phased pilot for providing school-based mental health. And if you want to find out more, I think there's some social media, well, I know there's social media posts that cover the board meetings, and minutes are on the website. But this is super important, and it sings to me because I literally remember when school-based mental health went away many years ago. I remember the office I worked at, and it was like a shock to my heart all those many years ago. And now, it's good. We're moving in the right direction. This is a pilot phased approach, which is good because we know the data that supports all this. And we know that undiagnosed, untreated, or inadequately treated mental illness can significantly interfere with a student's ability to learn and grow and develop So, the thing that I just want to repeat is that we know that schools offer a unique opportunity for early identification, prevention, and intervention that serves students where they already are. So they don't have to go and repeat their story to someone else. When a student comes to me, either I already know them, or I can walk right across the hall and talk to their counselor. I can walk down the hall and speak with their teacher. I have access to their parent's phone number, and I can just get on the phone and talk with their parent without jumping through a lot of hoops, without seeing, I don't have to see what coverage they have. I can move quickly. Let's see what else I was going to say. I think that's it for this one. If we want to move to the next one. Oh, you're already there. Sorry. This is what I think might be interesting, just to parents. One of the things that I hear often is I just don't know what the school systems are providing. I don't think they're doing anything, which is misinformation. I'll just say that it's just misinformation. The Wake County Public School System website provides a list of resources that families can access. And this is really similar to what most school districts provide Several North Carolina school districts have departments that I consider to be like exemplars for how to respond to like health and wellness. I mean, we're thinking, you know, a whole child approach. That support they have departments that support the collaboration of all personnel who work in schools, who increase school safety, with the understanding that school safety is both the physical safety and the psychological safety. So you can go to different, I mean, and I just clicked on, you know, I went to a couple of different school systems that I know that have model examples of, you know, health and wellness departments. But that's they have tips for parents, there's local community resources, there's online and telephone resources, and there are also stress management and wellness skills. And one of our school psychologists, who I know, gives some of those. So that's called community resiliency model, and those are provided to staff, and I believe, if I'm correct, that they are also provided to families can sign up for it too. So that's a great resource, and it's evidence-based. Next slide, please.
So I will jump in on this to provide a little information about what the county is doing to support mental health community needs. Lee has given us a lot of good information about what the school system is providing, and she's also given us a lot of information about some state issues. And I want to chime in and talk a little bit about the county's role. This started back in 2012, but the county currently doesn't provide direct services. And this was a change that was made at the state level some years ago. And the state shifted to what we call a managed care role of community mental health support. And so we have a managed care organization called Alliance Health that we work with, and they help their partners with us. So what the county's role is really to provide some funding, but also to basically facilitate partnerships with the school system, to facilitate partnerships with Alliance Health, with our local municipalities. Here in Wake County, we have 12 municipalities, to also facilitate partnerships with our area hospitals, as well as with our local mental health providers. So we do a lot of collaboration and partnership building at the county level. So some other things that we can provide and support with, first of all, crisis services. If you would go back there, go back for a second. Yeah, thank you. The wake.gov, this will be a link in your packet that you'll get. And this takes you to the behavioral health section of the Wake County government website. But in terms of when you have crises, obviously things you can do is to call 911. You can go to your nearest hospital emergency room and ask for the psychiatrist on call. There's also the suicide and crisis lifeline number, which I think Lee alluded to earlier, which is now 988. I wanted to share a few other services that the county helps facilitate or helps provide funding with is Wakebrook. Wakebrook is a behavioral health facility that we have here in Raleigh. It is a 24-hour services crisis hospital for anyone having a mental health or substance abuse crisis. And it's like I said, it's open 24 hours a day, and it primarily serves, though, from an inpatient basis, people who are 18 and up. There's also a Monarch Behavioral Health Urgent Care that the commissioners help to facilitate into being. And that is just like you would say, think of a medical behavioral health care clinic, but it's particularly for behavioral health. And that's located in Raleigh as well, as is Wakebrook. No appointment is necessary, and the Monarch Behavioral Health Urgent Care serves children and adults, children as young as 4 years old. So that's a service also that we offer in the community. We also have a mobile crisis management service that's a mobile unit that's provided by Therapeutic Alternatives. Again, that's a 24/7 crisis response program that we have that's on a mobile unit, and that's for children and adults as well. So these are services that the county is either helping to fund or helping to facilitate from a community mental health perspective. And as I said earlier, Alliance Behavioral Health is our managed care organization that we work with to provide community-based mental health services. And the Wake network of care is somewhat similar, I think, to what Lee was talking about that the school system offers, but this is an extensive resource on our wake.gov website that provides different types of services for families, anywhere from mental health needs to food insecurity to housing issues. So it's a pretty extensive directory of resources that we've listed on our website for our community. Okay, next slide, please.
I do want, as we move to the next slide, I do want to remind everybody that we are going to put every one of these links that we can into an email. If you attended tonight or you were registered, you'll get an email in a few days with a link to the presentation on our YouTube. And I'll repeat this at the end too. And all of these important links will be there. We're also going to send you the slideshow because there's a lot of stuff here that we don't expect you to remember, but you might want to look back on and for talking points or just for information in your community. Go ahead, Cheryl, I'm sorry.
No, that's okay. Thank you for that, because it is a lot of information. It's always helpful if you know you're going to be getting the information in slide format. So thank you for reminding folks of that, Yvonne. And just a couple of other community supports that I wanted to share. I think you left me there, Miss Yvonne.
I'm sorry, my mouse, I don't know why. This has just been a catastrophe tonight. We've had so much fun, right, y'all?
It's
But,
good. Hey, we're just modeling. We're modeling how you have to adapt and pivot. And pivot is a word we've used for how many years now, and with COVID.
Long,
yeah. So we have to adapt.
My mouse needs to stop pivoting though. I don't know why it's just jumping out on its own. Go ahead, Dr. Stallings.
That's okay, no problem. So just a few more community supports that I wanted to highlight. The school-based mental health teams that Lee was referring to, that's also partly funded by Wake County in partnership with the county school system and also Alliance Health. This is a program that serves more of our kids with severe needs. We've also funded 2 additional staff members to focus on suicide prevention, because we're all concerned about the increased rates of thoughts of self-harm and actual actions of self-harm by our young people. So this is something that the county is involved in. Last year, or the school year of 2021 through 2022, this program served about 605 students. And that may not sound a lot compared to the number of students that we do have, but these were some of our neediest students who got some quality services through this program. And in terms of one thing that's coming is we're going to have another youth crisis center that will be opening up in Fuquay later this year that we're excited about. This is going to be funded by Alliance Health. It's going to have a 16-bed inpatient facility as part of this, and it will serve mostly children ages 4 to 17. And this will provide 24/7, 365 services, which will help provide assessment, stabilization, and treatment services for our children. So hopefully part of the good news that we're sharing is that policymakers are getting it, that mental health is a real need. I think there is an appetite for us to continue to try to fund mental health better. And we're moving in a direction, but we still have a ways to go. So one thing that we're going to beat the drum for as we wind up is this now is the time to continue to advocate with your local and state government officials that we continue to need to fund mental health services. Another bit of good news is the opioid settlement funds that are coming to several states, including Wake County. We're going to be getting at least $36 million over 18 years, maybe more. And we have already received about a little over $4 million from this settlement. And the county has already done some assessment from the community in terms of how we want to prioritize how this money is spent. And we had community engagement sessions, and the results were clear. These last 2 sentences on this slide. The results were clear that youth should be a top priority in this work, with Wake investing in education, prevention, early diversion, meaning from the criminal justice system, treatment, and peer support programs. So we will be allocating funds to these areas that have been rated as top priorities to try to have prevention and intervention services to our young people. So looking forward to that. Next slide, please. And one other option on the horizon that we're excited about is, you may have seen this in the news, but Wake Med has recently announced that they will be building a behavioral health hospital in Garner. We expect that to be opening in late 2026. That will have 150 beds, and it will serve youth and adults. So we're excited about this increased capacity. We need more, but again, we're moving in the right direction, and we're really excited about Wake Med's partnership in providing this to our community. And as I said earlier, one of my last pitches to say is, you may know this or you may not, but budget season is beginning here at the county level, as well as local governments, and also at the state level. So now is the prime time to stay in contact with your local and state governments and connect with your officials and let them know your budget priorities. And please, please make public education and mental health services part of your message to your local and state elected officials. Thank you.
All right.
Lee, did you want to take this one?
Yes, I do. Thank you, Cheryl. That's all good information. It makes me feel good to hear we've got so much going on in Wake County. So these thinking forward, because as Dr. Stallings has let us know, we do have a ways to go, and we are headed in the right direction. These are future supportive and evidence-based solutions. There are a variety of tools to use, which include Medicaid expansion, and there's been some really good news on Medicaid expansion, if you're following the news there, and I think probably most people here are. But expanding Medicaid would ensure access to affordable health insurance coverage for more than 600,000 North Carolinians. And it would also increase access to mental health and substance use services across the state, particularly in rural communities. So that's here right now. The other solution would be Leandro recommendations. Leandro is a shortened name for the Governor's Commission on Access to Sound Basic Education that has specific recommendations for staffing ratios, specifically for specialized instructional support personnel, as well as early childhood education that includes behavioral health. So I'll stand at the top of the mountain and advocate for early childhood education. And I hope everyone on here will as well. Another advocacy priority is for increasing access to mental health is to increase is to address the recruitment and retention of school psychologists in schools. It is an ongoing priority to make our salaries competitive in order to retain North Carolina talent, to bring new people into this profession, and to recruit across state lines. There are several states that have too many school psychologists, and we want to be able to be one of those competitive states that pulls them in, and we aren't at that spot right now, but we could be, and we need to provide a salary supplement for nationally certified school psychologists, which I am and several other of my colleagues are, similar to what other educators receive for national certification. Another evidence-based solution is the PREPARE curriculum. That is out of the National Association of School Psychology. It is an evidence-based curriculum to address crisis team responses and to increase school safety. There are many districts in North Carolina that are exemplars for school safety, and their efforts have resulted in increased school safety. I'll just give a shout out to Cabarrus County and Rockingham County. I believe both of those districts and several others use the PREPARE curriculum, and it is being talked about more in Wake County. Again, just an important, and another one, you know, obviously a future direction is just ongoing awareness of local and state resources, which is what we're doing right now, and ongoing advocacy. When people ask me, how can I get involved? Like, you're involved right now, being aware and talking, just going and having a conversation with what's going on in your child's school, what role do you have? Go and talk to your House representative, your state senator, your local officials, Dr. Stallings. And then I mentioned the state exemplars, but again, just an important and essential message to end this presentation with is that mental health supports and services improves student outcomes. We have data across time that supports the need to invest in this for North Carolina children and families. And our state has the information to know the direction that we need to go in, and we are going in that direction. And we just need to keep advocating for the recurring and sustainable funding sources and investing in early childhood. And I just want to thank everybody for listening. And I assume that everybody on here is already advocating for children. So I thank you for doing that and for continuing to do that. And I will pass it back to
Yeah, I want to go ahead now and just see if there's anyone who has any questions. One of the things that we're trying to do tonight is to give you a quick overview of the status where we're at. And I think there's a couple things that are very clear after looking at all this in summary. You know, we have a mental health crisis in our society, and it is in our schools as a reflection of the society and the communities we all live in. We have a lot of resources, but we don't have enough. We have a lot of excellent trained school psychologists. They all have a master's or above, and they're well trained, but there's just not enough of them. And one of the things that we have been advocating for a decade now is for more state funding from the General Assembly. While that's being said, don't forget what Cheryl said, which is there are also funds that are provided by county commissioners across the state, and sometimes by local cities who work in partnerships for crisis intervention and those kind of things. So there's a lot of opportunity, but I think what's really important also is to become aware of the resources we do have. Lee, I was very interested in some of the things for parents about, parent resources, parent videos, parent information, because, a lot of times parents just want a handle on some place to go, find an answer, figure out what's going on. So I really appreciate that. But I wanted to kind of stop and see if there's anyone who has any comments or questions from either of our school psychologists here tonight. If you have a question, just unmute yourself and ask it out loud. It's perfectly okay. In the meantime, let me just say, Cheryl, you have been inside the school system and now you are out in private practice. What do you see are the greatest challenges when kids come to you? I mean, what is the biggest problem that our families and kids are experiencing when they're trying to get mental health services?
Well, one thing is the timeliness in being able to see people. I've never been busier, unfortunately, and I've been in mental health, my practice for over 20 years, and I was in the schools prior to that. So the concern is the capacity issue, not having enough providers to meet the needs in a timely manner. But I belong to a large network of colleagues in the Triangle area. So we are constantly working with one another to, like, if I can't see someone timely, we will refer, within our colleagues in the area to try to see that people are seen as soon as they can be. But similar to what Lee does in the schools, I do a lot of psychoeducational evaluations too. So I do evaluations for students that may have disabilities, and then I also do therapy. So in terms of therapy, just seeing a lot of stress, a lot of anxiety, a lot of depression. And I also, evaluate students who may have disabilities to see if they need extra supports in the school, such as 504 plans or IEPs.
So if a parent's listening tonight, or perhaps there's a grandparent or even a citizen who likes to have information to pass on when in their community, if you're looking for help outside of the school system, what's the first thing you should do? And the second thing, I mean, how do people find out how to get help
Mhm. Well, for me, since I've been in practice for quite a while, sometimes it's just word of mouth. So a lot of schools know me and my practice, and we also get a lot of referrals. So my primary referral agencies are typically the schools as well as pediatricians. Pediatricians are on the front line also, for mental health screening and also mental health support. So we get a lot of referrals from pediatricians in schools and sometimes faith communities too.
So I haven't even thought about that. So obviously a great place to start is talking to your child's doctor.
Yes.
If you're
Yes.
so fortunate to have one, and
Yes.
talk to your child's doctor, and then I guess check your healthcare program, package to see what is offered through your health insurance. And Cheryl, so for those folks who do not have health insurance, I think that you mentioned some of the services like through Alliance, Wakebrook, Marnock, these kind of programs, and these new hospital beds that we have now, and those that are opening up is certainly available. And is this kind of thing available in most counties?
I will say that every county in the state is being served by a managed care organization. Alliance is responsible for about 7 counties. So, it's divided up throughout the state, but every county has access to a managed care organization. So again, if you're living in a different county other than Wake, you might want to reach out again to your child's doctor, the school. You want to reach out to someone, a trusted individual, maybe your health department, your county health department, and they can put you in contact with your managed care organization, because Alliance is specifically designed to help our lower income residents and people on Medicaid. And with Medicaid hopefully expanding, we don't know exactly what that's going to look like yet, but that's, as Lee said, that's going to open up more access to care, which is surely needed.
Bill Fletcher, welcome.
Yvonne, thank you. This is certainly a worthy topic, and I wish we had about 12,000 here as opposed to what we have at the moment. Hopefully reproducing this will generate more audience. Is there, this is kind of a left field question, are there any particular objectives or tasks that a civic club can undertake in this whole realm of issues? I've got a very active civic club in Cary. We're planning next year's work, and the whole issue of student health, student mental health, fentanyl, et cetera, et cetera, et cetera. Is there anything that a civic club can do? Or would you identify, and maybe if you can't do it here, do it offline? Because we got lots of groups of adults and grandparents that would love to find some way to have a positive influence on the needs of our children.
Sure, I'm gonna let you and Lee go first and share anything you have, and then I'll jump in.
Well, I would just say if they can speak to the General Assembly and get adequate funding for, for salaries. The workforce shortages in schools, and I'm speaking from personal experience, the workforce shortages just stretches everybody that is currently in the schools. And just like Cheryl, just like Cheryl is seeing, there's not enough hours in the day. The same is true for us. I mean, we've got to have competitive salaries to even get, to retain the ones that we have, the staff that we have now, in addition to recruiting new people to come into schools. So it's
political influence in terms of my personal belief is that the whole issue boils down to time with a qualified adult.
Mm-hmm.
Time with teacher, time with a caring adult who's knowledgeable about how to help a student make better choices. And we don't allow that time. We don't allow that time by policy and practice. And that just frustrates me that the legislature thinks one size fits all, and all is a very different. Our children are so different from one day to the next even. So Okay, so
I think-
political influence.
Yeah, political influence, because if you can get people to see, like, you know, a 30-minute or a 1 hour time, or just a daily, or not even a daily, like a weekly, a two time a week check-in with a student, with several students, there's the ripple effect of that. I
Sure.
literally see it. Every single child I work with, their attendance goes up, their grades go up, they feel better about themselves.
Somebody cares.
Somebody cares. They've got someone in school. I mean, the statistics of 60% of high school only 60% could name a teacher that cared about them. I can still tell you every single teacher I had from nursery school to Mr. Parker, my biology teacher, is why I went into biology. That didn't work out for me, but that's why I went into biology in college. I loved Mr. Parker. We dissected every animal for
The good old earthworm.
earthworms, everything. I was horrible at biology in college. And I found my spot, but it's because he cared. I mean, he I had tons of teachers that cared. It makes a difference. And I tell kids that all the time. I literally say to them, I care about what happens to you. You are important, and we're gonna make it better. And they pop into my office. Someone popped in today. And then he goes, and then someone else popped in while he was in there. He said, I'll catch you later. I'll catch you later, Ms. Coquina. Okay, we'll catch you later.
So I would like
Makes
to
a
add
difference.
what Lee's saying, Bill, and I know you know this because your service for decades on the school board in Wake County gave you all these wonderful insights and experiences. But when I'm talking right now a lot to principals in Wake County, as an example, we need just more volunteers in the school too. We need people who are willing to come in and be a mentor, meet with kids on reading or math. And even though that sounds like it's academically oriented, the principals I talk to tell me that the kids get more out of having somebody who shows up. It's, Mr. Smith's going to come and see me every Friday. And that often that relationship, that tutoring, mentoring relationship is more important than the math they might learn. And so I think that we are shorthanded. We don't have enough adults in the building any given time to sit in the cafeteria, to read books, to tutor. But I would also say, Bill,
just to talk with them.
Talk to kids.
Even a 20-minute talk time.
Your organization also, Bill, I think would understand that we need people to educate. And that's what we're trying to do tonight. We're trying to make sure people understand we have issues and they are solvable. This is what the ratios look like. We don't have enough folks. We're not paying them enough money. And we do have some solutions to these issues. So we're trying to educate, because I believe that the more that people understand what's going on, that they're more interested in advocating. I'm hoping that's true. Okay. And I do also believe that the political, as Lee said, is important. And I think it's important at every level. We cannot solve this nationally. The U.S. Department of Education can't fix all this. Neither can all of the General Assembly. But the partnerships that Cheryl was talking about were exciting to me, where you see the school and the county working together. And they've got to step in and fill in the gap, unfortunately, because we're not seeing the kind of progress we want in the General Assembly, but we should not give up. We have, as Lee said, made some progress the last few years, and we've had some increase in number of helping professionals they funded. So I don't think we should give up. But Cheryl, I want to give you a chance to add your thoughts.
I appreciate, Bill, you stepping up, as well as all of your service on the Board of Education as well. And I think if your group wants to volunteer, then I know the Wake County Public Schools can find a place for you to plug in. And so you might want, since you're in Cary, you decide if you want to serve the Cary area and reach out to your school board member there, or to adopt a school or schools maybe. or possibly think about where are some of our highest need schools and maybe adopt them. But I'm sure the Wake County schools can find a place for you and your volunteers. And I know I would appreciate that service. And maybe you could be examples for other civic groups, you know, in the county as well. So thank you for that.
Thank you. The global challenge scares people off. And the reality is it's a one person on one student challenge. And that's where the difference will be made. So there are just not enough hands. That a very smart superintendent once told me that in an autism class, I said one adult hand for every child. Talking about staffing ratios. And we're talking about it as complex an issue with mental health as we are with many children experiencing autism. And we don't have enough hands, and the hands that we have don't have enough time to invest as they want to in the child. So I see what I can do.
Thank you.
I can't promise anybody else is going to show up, but I'll see what I can do.
But like you said, just start with one child or one school and make your difference there. Thank you.
Yeah, thank
So
you.
Lee, I wanted to ask you kind of the same thing I've asked Cheryl, you know, like where to go in the private sector. So you're in the school setting and it's very similar in many other counties. How do parents contact schools? How do they get in touch with? How do they communicate their needs for advice or help or connections? What's the best thing parents can do?
Well, every single website pretty much looks the same in Wake County now. So that to me is it's a common website. And so if you can navigate one, you can navigate all of them. All of the staff are listed on the website, and you can see some schools have a Google website that is for, you know, counselors, psychologists, and social workers, but you can just find us. I mean, parents find me. They'll just email me or call me, or they'll call the front desk, or get in touch with me through, you know, school counselors. So I say, you know, we're a team in a school. So if they're in contact with me, they're in contact with the counselor, and maybe the social worker, and maybe the nurse. But I don't see that as a problem. I think parents can easily find me.
So so maybe with Cheryl's model of talk to your child's doctor, is this kind of also like talk to your child's teacher and ask them to connect you to folks, resources in your school? Is that a convenient way for parents to figure out who they're supposed to be talking to?
Yeah, I think so. And sometimes it comes out of, you know, sometimes it comes out of a consultation. So for example, a teacher in elementary school may say, hey, I want to meet with you about this student. I've got some concerns. Can you come in and we can talk about what the issues are? And sometimes I'm like, well, we've got to get, you know, the parent involved in this and what's happening. It really just depends. But I am there. I am physically in schools every single day, and easily accessible. Like I routinely tell people, I'm an email away. Come knock on my door. Call me. I can just walk down the hall. That's the beauty of having instant access. Instant access.
All right. I want to see real quickly, does anyone else have a question? If you do, kind of unmute yourself. You don't have to raise your hand or anything like that. Just speak up. So, Lee, if you had to give a few pointers to parents about what to do if they're worried or concerned about mental health issues with their children, what would be the 2 or 3 things that you would encourage parents to do?
Well, I mean, talk about it, number one, and talk with your school about it. I mean, schools we just have so many resources. I mean, sometimes we have so many resources, we kind of forget We're like, oh, we have these great things going on, and we forget about them. But I would say, you know, I do always try to think through a whole child framework. I mean, and I'll put it in my reports that please, you know, it's up to you, but I highly encourage you to share my report with your pediatrician if you have concerns. It helps for everyone that's involved with that child to know what's going on. And a lot of times we find out like, oh, this isn't just a medical problem, this is anxiety. So talking with your child's teacher and just sitting down and talking about what's going on with them and talking with the child. How do you feel? When are you feeling this? You're going through a whole problem solving model with them. So talk with your.
And Cheryl, I want to ask you, do you want to comment or anything you want to add from your practice that would be kind of some practical things for parents to keep in mind or think about if they're concerned about these kind of issues with their children?
Just to try to be persistent and keep advocating for your child, because parents are, first of all, their best teachers, their first teachers, and also their best advocates. And sometimes parenting, you know, can be overwhelming. You know, it doesn't come with an instruction book. We all know that, but keep asking and be persistent. And it's sort of like if you don't ask, you definitely won't get it. You know, so stay persistent. And reach out to your teacher, to your counselor, to your administrator, whoever you have a good relationship with the school. And then if that doesn't work, reach out to your pediatrician, your child's pediatrician, even a faith leader if you're involved in a faith community, because just keep advocating, because there will be somebody who will connect you to hopefully help support you in your parenting journey, because I know it's not easy and sometimes it can feel overwhelming, but we do have services available and we want to support our families and our children in Wake County and throughout the state and the nation and the world.
All right. Very well said. Yes,
Yvonne, I just wanted, could I add something real quick? I do try to tell parents on a regular, get your kids involved in something, whatever that is. If it's a church group, if it's scouting, if it's YMCA groups, if whatever is like a healthy group for them to be feeling a part of a group is good. And it keeps them connected, and you learn so much from it. So that's, you know, that's a good positive.
Good advice. Right. So I'm going to wrap us up now because we're getting to the end of our time that we've allotted. I will promise you that you know, we're going to send you some wonderful links and some resources from these two very talented women. And we're also going to send the slideshow so you can copy down some of these numbers and stats and use them as your talking points. In summary, Lee or Cheryl, do you have any summary comments you'd like to make before I wrap us up?
I don't have a summary comment. I'm sorry.
That's fine.
Well, I just want to say to everyone who attended and maybe who will watch this, thank you for your interest in your advocacy for children and mental health. We've made progress, but we still have a long ways to go. But together, I think we can make a difference. And as been stated in this presentation, we know what the solutions are. We just have to get the funding to get there. So for those who live in Wake County, I am your county commissioner. Feel free to reach out to me anytime, and I will be happy to work with you and try to serve you to the best of my ability. So thank you all for attending.
And
Thank you,
Cheryl. And thank you, Lee, both of you, for being here. And what people don't know is that all the time that we spent gathering this information and talking about it, meeting and planning to make sure that we provided an interesting and important information. So thank you all very much. And then, of course, I want to say on behalf of Public Schools First, we are a public education advocacy group. One of the things that we have been pushing very hard for over the last 5 or 6 years is to increase helping professionals. Some of this grew out of our interest in dealing and looking at trauma-informed practices. Many of you may have heard of something called adverse childhood experiences and how they impact children's ability to learn and to grow healthy. And so we became very involved and interested in trauma-informed practices and being a trauma-informed organization. And we show often a film called Resilience, which shows the impact of adverse childhood experiences on our children. And I encourage you to go to our website or to our Facebook page. Here are all our little handles here, and look up for screenings. We show it once a month virtually and have a great discussion afterwards. And I encourage you to come and watch this film and talk about these issues, because I think you'll really have a deeper and a more immediate connection to some of the things we're talking about with children today. Because what happens with these impacts that children experience through adverse childhood experiences, these things that create this stress and this depression and these things in children have very significant impacts on their lives. They're not just in school, but socially, and even their health long-term as adults. So this is really important. And we know that one of the ways to be a trauma-informed and trauma-sensitive school is to have these helping professionals there, to have these adults that can connect directly to children, school counselors, social workers, psychologists, nurses. They all have a role to play in providing and preventing adverse childhood experiences and in mitigating some of the impacts of these things. So we asked you all to share this information. We asked you to talk to your county commissioners. We asked you to talk to your school boards to make sure they're doing the staff development that they need to be doing. As Lee has pointed out, some of the programs that are available for training. And we encourage you to talk to your General Assembly. They are in session right now in Raleigh. They are setting the 2-year budget right now. And this is when we need to be talking to them about increasing our pay for our helping professionals, increasing the pipeline, more internships, more scholarships, increasing pay for our educators, our teachers. So we encourage you to do that. If you need a speaker or you'd like for someone to come and talk with you, we're available. Just here's our email, info@publicschoolsfirstnc.org. We hope you have a really wonderful evening. And once we send you the slides and this information, I hope you'll send it out to 100 friends each, because we really want to not only educate, but we want to advocate for our children and all the professional staff in our schools. Once again, thank you, Lee. You are marvelous. You're not only a wonderful school psychologist, you're a wealth of information. And Dr. Stallings, welcome. We're going to be getting you back again, because you're knowledgeable and you also have such a deep professional experience in these issues that can bring bear to public policy and funding at the local level. So we appreciate that. So good night, everybody. I hope we hear from you soon.
Thank you, Yvonne. Thank you, Cheryl.
Bye-bye.